Hi, Kevin Henry, the Group Editorial Director for Advanstar, and I'm on a Google Hangout today with Mike Uretz. He is a nationally known EHR and health IT educator and consultant. He's been involved with federal electronic health record mandates and incentives since they were first introduced, and is presently assisting dental practices and groups with obtaining incentive monies. He's also providing guidance to dental software vendors wishing to become EHR certified. He is the founder of dentalsoftwareadvisor.com, a great site, might I add, and that's a trusted industry resource on dental software information. Mike, one thing that I've heard is that a lot of software vendors and consultants are being a little bit aggressive and trying to convince practices that it's almost you have to buy this now or you're going to miss the boat. What have you heard about this kind of pushy tactic, and can you kind of comment on, is there anything to it?
Well, I think you're being nice, Kevin, when you say a little bit aggressive. A little bit aggressive. I've actually been involved with this myself. About the last, I don't know, maybe the last 2 or 3 months, I've had a number of practices calling me up, asking me questions about, do I need to do this by the end of the year? What's going to happen? And as I've traced it back and talked to these practices, what seems to be happening is that somewhat, I guess, aggressive vendors and consultants, seeing that there's opportunities here to sell software, sell services, have in some cases really tried to put a sense of urgency to practices to get electronic records, not for just patient care reasons, but to give them the idea that if they don't do it, they might not be eligible for the money and might be missing the boat. Okay, so I've seen a lot of situations and heard a lot about situations like this where vendors have been overly aggressive at trying to get practices to buy by giving them the sense of urgency.
And you mentioned the incentive money. Can you kind of discuss how a practice knows if they're eligible for that incentive money or not?
Oh, absolutely. Now, I'll give you about a 10,000-foot overview because it really gets a little bit tricky and it varies a little bit state to state because the different state Medicaid programs for EHR are a little bit different. But in general, one thing you would think about is, first of all, a 30% threshold for Medicaid. So in other words, if you're doing 30% or more as a practice or individually as a provider, 30% Medicaid, then you potentially are eligible for incentive money. Okay, also it does get a little bit tricky because there are other factors. So for example, if you're in an underserved area, there are concepts called needy patients, which might not be Medicaid patients necessarily, but let's say they're on a sliding scale, or they're children under the CHIP program. So there are really different ways to determine eligibility. But remember, just because you're eligible doesn't mean that you automatically get the money by having an EHR, because there's a concept called meaningful use. And meaningful use means that you must meaningfully use. In other words, you need to use the electronic health records to better patient care. So that's really part of the program. Number one, being eligible, and number two, using the EHRs to improve patient care.
And I also know that you and I have talked, just because you're eligible for it maybe doesn't mean that that's the best reason to put it into your practice, right?
Oh, absolutely. I'm so glad you're bringing that up because I talk to so many dentists. I mean, I'm trying to be a little bit of an evangelist for electronic health records. And I talk to so many dentists that say, well, you know, I'm not eligible for the incentive money, so I don't know if I should get electronic health records or not. But there are so many other reasons that you and I have talked about over time for increasing patient care, improving cash flow actually in a practice. Things like electronic prescribing, being able to have med lists at your fingertips, or having templates, certain templates you can use for procedures, or being able to share information with other providers, specialists, for example. And that's just the tip of the iceberg. So there are a lot of reasons to get electronic health records. It shouldn't just be whether you're eligible for incentive money or not.
And Mike, after our viewers have watched this information, how can they get in touch with you for more information or if they have more questions?
Well, I guess probably the best way, Kevin, is if they want to email me at Mikeu, M-I-K-E-U, at dentalsoftwareadvisor.com. Probably the best way to get a hold of me. They can also call at 425-434-7102. I'd be happy to answer any questions. I really want to make sure that folks really understand this program because it can be very confusing.
Mike, as always, I really appreciate your insight and your time. Thank you so much.
Oh, thanks, Kevin. I appreciate it.